Hello everyone, my voice is clear. You can please type in the comment section so that we can start our session. I have shared the link of this live session in the comment section so you can share with your friends if someone want to join. I will reshare this link here. And you can just type your questions so that I can answer to you. So it shows we have 3 participants right now in the live session. So you can please share this link with your friends and so that we can start. Now we have 4. Thank you for confirming. Yeah. So I have received many messages on the LinkedIn. So there are many questions they are asking. So just type your questions here and step by step I will answer to you. I have shared this link again in the comment section so you can share it with your friends. Okay, so one question I have received. Please explain on how to approach employers. Okay. So the first step is there are some steps involved in this. So the first step is that you should have a resume. Um, Definitely, you should have qualified the CAPS exam and the other uh, requirements like the upper registration you have. And after this, you should have a resume, and then the cover letter, and then you can start applying on different platforms like the best one which I will recommend is seek.com.au. So once the employer will advertise any vacancy for the intern position, so you can straight away submit your resume on that website. Another one is indeed.com.au, which is also really helpful. Uh, Along with this, you can also uh, attach with different employers through LinkedIn. You can also send your resume uh, to the email addresses of different employers. So you can just Google it. Like there are different employers who are sponsoring people from overseas, like Chemist Warehouse, um, like Discount Chemist, like there are many other organizations. But the first thing is that you can work on yourself. You should design a perfect resume. You should mention some skills. You should have knowledge about the Australian healthcare system. You should mention um, what type of certifications you have from the Australian organizations, uh, what type of skills you have. You can also type your country um, who have joined this session. You are from India, you are from Pakistan, or you are from which country. So today we will talk about this journey. What are the challenges? I will help you in every step. Um, so I will also talk in Urdu. I will also talk in Pashto. I will also talk in English. So just mention your country. Okay. So yeah, Dr. Asmat, please explain on how to approach employers. So this question, yeah, like these are some of the requirements. So first thing is that you should work on your resume. Like resume is the first thing. Okay. Now how to strengthen your resume? This is very important. So like you should learn some skills. If you will have some knowledge about the Australian healthcare system, so you can visit websites like PBS, Pharmaceutical Benefit Scheme. You can learn the scheduling of the drugs here, like Schedule 2, Schedule 3, or you can say S2, S3, S4, S8. So, like this. You can also learn what is the validity of the prescription in Australia for the S4 medications, which is 1 year, for the S8 medications, which is 6 months. So you can learn and you can mention it in your resume that you have knowledge about the drug scheduling, You have knowledge about the PBS. You have knowledge about the dispensing process. So these things are very, very important. Um, yeah. Just type your questions in the comment section and I will try to answer to your question. Okay, so how do you see the scope of pharmacists in Australia as many applicants are waiting for visa? Yeah, this is true. This is the reality that many pharmacists are waiting. Uh, but one day you will be here. And it is also true that many pharmacists have qualified the CAPS exam. But work on yourself, uh, strengthen your profile, strengthen your resume, um, approach the employers, um, search and focus the regional areas in the Queensland and the New South Wales. So there are different organizations, different pharmacies who are like sponsoring people, and there are different many students, many pharmacists who have qualified the interview, and now they are in the visa process. Yeah, Wali, thank you so much. Yeah, it's after almost after 5 months. Yes. Okay, so the question is Daulat Ali Khan. I have 8 years of UAE experience, passed my CAPS exam. Oh, that's really nice. If you have 8 years experience, it means that you have really strong profile. What pathway I should choose, which will be the best in my case? So if you have qualified CAPS exam, so definitely I will recommend that you can submit EOIs for the 491 or 190 visa, work on your profile, increase your points. That is one pathway and one option. But along with this, do not wait just for that pathway. Along with this, you can also um, try to send resume to different organizations and also work on the employer sponsored visas pathway like 407, 482. So one day will come that you will receive email from a pharmacy. But the main problem which I have observed, because I have reviewed the resumes of many pharmacists, the problem with one problem, which is the major problem, is with the resume. So work on your resume, strengthen your profile, learn the Australian healthcare system. There will be some pharmacists who will not be agree with me that as we are coming to Australia for the intern pharmacist position, so why we can learn the Australian healthcare system from now as a overseas pharmacist. So if you will learn some something from the Pakistan, from India, from Philippines. So definitely it will really help you. If you will mention that in your resume that you have knowledge about the Australian healthcare system, so definitely employer will be interested in you that this person have knowledge about the Australian healthcare system, like the cards which are used here, the Medicare card, the uh, safety net card, uh, the types of the scripts here, like paper script, electronic script, fax script, um, S8 medicine script. So, what are the S4B medicines? What are the S4D medicines? In which case, we will retain the script in the pharmacy. So, just you can learn these things, um, and then you can mention in your resume that I have these skills. So as the competition is more nowadays, so you have to work on yourself. Um, and the main problem is that many people have a lot of experience, but they don't know how to present and how to show that experience in the resume. So one day I will try to share my own resume here, and I will definitely help you on that. What key points the employer look for in employee? What online courses one should do? Okay. So what I think that doing online courses, these are important. If you will do some online courses from different colleges, like Australasian College of Pharmacy, like Guild of Australia, like many other organizations. But what I think the most important thing is that you learn the Australian healthcare system. That is very, very important because what I think that employer will not uh, be interested in certifications more as compared to if you have knowledge about the Australian healthcare system. Because practical knowledge is very, very important here. Because once you will start dealing with the patient and the counter. So no one will ask you about your certifications. So they will give you Medicare card, they will give you healthcare card, they will give you safety net card. And if you will have no idea, then definitely the employer will be not happy. They will train you. Definitely you are doing internship. You will do internship. But like if you will have knowledge as the overseas pharmacist about these things, and you will mention in the resume like you have knowledge about the Medicare card, you have knowledge about safety net card, you have knowledge about the drug scheduling, you know that what are the pharmacy medicines, what will be my role, um, how to communicate with the Australian, how to start, how to greet. So these are many, many things. So if you will mention it in your resume, so I think it will definitely help you. Just for me, see, I'm sorry if I will miss any question. And you can please share this live session with your friends if someone want to ask questions so that I can help you. I have shared in the comment section. Okay. Isn't there the case that they are working unsure or offshore? Okay, so also Pakistan and India are the borderline, their priority. This one is okay. Mm, so yeah, this is reality that what I think if someone will be here So definitely the opportunities will be more. But in the regional areas, there is a huge demand of the overseas pharmacists. I am 100% sure about this. But the main problem is that how to approach employer, how to present yourself. That is the main thing. Because if you will check uh, any jobs which are advertised on the seek.com and give.com, so many pharmacists will apply for this specific job. Now you can think like an employer, not like an employee. That what you will check and what you will see, um, if you want to hire someone for your organization. So definitely you will check that how much experience and how much uh, yes, okay. So you will definitely check what type of skills you have, what type of experience you have. You have experience in the education side, in the academic side, you have experience in the industrial side, or you have experience in the community side, or you have experience in the hospital side. So definitely there are certain criterias, and they will shortlist the candidates based upon these criterias, and how much you have knowledge about the Australian healthcare system. So yeah. Mm, I think this is up to somewhat this is true, but it's not like, because how many onshore pharmacies will be here in Australia? I don't think so. That there are many pharmacies, and that pharmacy which are like doing scripts more than 150, so they need intern pharmacists, right? So in the bigger pharmacies, uh, they have two interns. You should be positive and you should work on yourself, right? And after this February exam result, there will be many vacancies. Yeah. So before that, you should work on yourself and you should strengthen your profile. Where you reside in Australia, sir? Yes, I'm here. I'm here. Okay, so now, yes, definitely I will show my resume one day. I will arrange a session, and I will share definitely. But the problem is that once I share resume, so many of the pharmacists just copy data from my resume and straight away paste it, and like it's not like good, right? Not good for you. Um, you can just get an idea from someone resume, but it's not good if you will just copy and paste in your resume. That's why I stopped sharing my resume with any other person. Okay. Any other question? So yeah, after this February result, there you can expect there will be vacancies. Ronaldo, USA is best. Yes, everyone have its own opinion. There is no doubt. Ah, okay. In which month internal exam is going to happen so that fresh positions are created? Okay. So there are many interns who are just waiting for the result. They have already appeared for the exam. Sir, I complete my complete degree 5 years from Pakistan. I want to go to USA. So if you want to go to USA, so it's not a bad idea. It's really good idea, but you have to qualify the exams in the USA. So if you have someone who can help and support you from the USA, so definitely go for it. Any other questions? So I can answer to you. It's 11:42 p.m. here in Australia. So here is Catherine, my student. Hi, Catherine. Catherine is also one of my students waiting for the visa. She has already applied for the visa. Qualified the CAPS exam in November. So there are many pharmacists who, who are waiting for the visa, who have secured the intern pharmacist position. So be positive. Mm, Divakar Sharma. Hello, sir. Hello. Yes, Ronaldo. Yeah, if you have knowledge about this pathway, so definitely go for it. So this session is for the Australia, but you can ask from someone who is in the USA. So that will be, I think, better for you. But one of the visa for the USA is, I think, B2 visa, which is good one. So you can ask from your senior if he is working in the USA. He can guide you. Okay, so can you please elaborate on the remuneration and salary of the intern pharmacist? Okay, so the salary of the intern pharmacist here, you can visit Fair Work Australia website. So everything is present on that website. But I will uh, tell you that the salary is the starting salary, and every intern pharmacist can expect this amount. So it is 28.66 AUD per hour in the first half of the training. First half of the training means 6 months, first 6 months. And after 6 months, in the second half of the training, it will be like somewhat 29.63, something like that. So you can visit the Fair Work Australia website. So all the details are there. Yeah. Any other questions? So you can please type in the comments section and I will answer to you. Yes, I'm a pharmacist, Ronaldo. Okay, what are the books we need to read, sir, while waiting for visa? So we can prepare once we reach and start the internship. Yeah. So this is also a very good question. So as you are waiting for your visa grant, so I will recommend that do not study books at this time. Just you can learn and you can visit the PBS website, Pharmaceutical Benefit Scheme. You can uh, learn the rules, the drug law, like to which state, in which state you are working, like Queensland. If you are working, you will work in the future in the New South Wales, so you can study the drug rules of the New South Wales. You can study and visit the Medicare website. You can also study the types of the cards. You can study uh, what is concession price. You can study the drug scheduling. You can study uh, which medicines are under supervision of the pharmacist. You can study how to deal with a patient over the counter. So I will recommend that you can uh, study. But if you have extra time, so you can also start studying AMH. AMH will really help you. Yes, this is a really good idea, Catherine. And start study. Like here, the validity of the script is 1 year. Um, some medications script validity is 6 months. Safety net card is that card on which um, once, so there is a specific threshold. So once you will reach that threshold, then the rest of the year, like the medications will be free. Um, so yeah, these are some of the points. You can study how to identify that this is invalid script. Like suppose there is a script of acid medication, um, acid medication schedule 8, like methylphenidate, like dexamphetamine. So how to identify? So the rule is there should be written instructions from the doctor side, the frequency of the dose, uh, like the dose of a drug, quantity of the tablets or capsule. So, like these handwritten instructions are important. If there will be no handwritten instructions, it means the script is not valid. So you can't dispense on there. So you can please learn these skills before coming to Australia. Okay. Any other question you can please ask, and then yes, Ronaldo, I'm from Pakistan. Where are you from? Are you a football player, Ronaldo? I will try to manage my time to arrange these type of sessions. So yeah, it will help you. But you can please ask your questions. It's 12 p.m. here. Hello, Ten Ebela. How are you? So there is another question. Anvita, did skill assessment outcome validity is necessary during provisional to general registration period? Okay, so it's a very good question. Um, One is skills assessment. Skills assessment means that once you will submit the documents to the APC, so they will send you email that your documents are perfect. So then you will sit for the exam. After the exam, they will give you a letter which is called skills assessment outcome letter. So the validity of that letter is 3 years, right? But once you will apply for the provisional registration, so the rule is that you can renew your provisional registration 2 times. So once you will get your provisional registration, So the expiry will be 1 year. So after that, you can renew it 2 times. So this is the law. Please ask questions so that I can answer. Anything which is coming in your mind, any confusion. What's the best visa for intern pharmacist? I will recommend the best visa is like um, there are some like points like if someone. Okay, so like the visa, we are talking about the visa. So the visas option like 491, 190, these are the best visa, but like the processing time and getting the invite, it's take a lot of time. So I will recommend that if you will get the employer sponsored visa, so the 407 visa is the best visa. And the 482 is the best visa as compared to 407. But getting 482 is hard as a overseas. But if you have like experience and you have the pay slips and everything, and if your lawyer is competent to prove your experience, then 482 is the best visa. There is another option 494, which is also a 5 years visa, and after 3 years you can straight away apply for the PR. So do not just think about the regional visa that if you will get 491, then it's okay. If you will get 190, then it's okay. So all these visas will leads to the PR. Like suppose if someone will receive 407, so then after 1 year you can convert it to 482, and then after 2 years, 482 will be converted to 186, which is PR. If someone will get 494 visa, 5 years visa, so after 3 years straight away converted to the PR. And similarly, 491 working 3 years, you can convert it to 190, which is also PR. So these are different pathways, but the end result is like PR. So I will definitely recommend the employer sponsored visa because the processing time is very less as compared to the other visas, and you will have also job in that visa, which is also really good. Yes, you can please ask the questions quickly, and then I will close this web session. I will try to arrange another session tomorrow, maybe. I will let you know. I applied for 47 visa. Any other question? If there will be any questions, so you can please type in the comments section and I will answer to you. On which month of internship can we write intern exam? So, like, once you will complete your 75% training hours, depending upon your duty hours, so then you will be eligible to sit for both exams, written and oral. So I have to close this session after 5 to 10 minutes. So you can please ask the questions and then I will close it. I think there is no questions. Thank you so much for attending this live session and see you next time. Bye bye.